How does Meconium ileus relate to CF symptoms? Imagine a newborn struggling to pass their first stool. This is often the first sign of a condition called Meconium ileus, which is closely linked to cystic fibrosis. In babies with cystic fibrosis, the body produces abnormally thick and sticky mucus because of a defect in the CFTR gene. This gene is responsible for creating channels that help move chloride ions across cell membranes. When these channels don't work properly, mucus becomes thick and sticky throughout the body, including in the intestines. In the gastrointestinal tract, this thick mucus causes the meconium, which is the baby's first stool, to become abnormally dense and sticky. Normally, meconium is soft and passes easily within the first 24 to 48 hours after birth. But in infants with cystic fibrosis, the thick meconium can block the last part of the small intestine, called the terminal ileum. This blockage is known as Meconium ileus. It prevents stool from passing normally and leads to symptoms like abdominal swelling, vomiting, and sometimes difficulty breathing because the distended abdomen can press against the diaphragm. This early intestinal blockage is a key sign that prompts doctors to investigate further for cystic fibrosis. In fact, about 80 to 90% of infants diagnosed with Meconium ileus are later confirmed to have cystic fibrosis. The blockage can sometimes cause complications such as bowel perforation, twisting of the intestine, or infection in the abdominal cavity, which requiring prompt medical attention. Meconium ileus is more than just a gastrointestinal issue. It reflects the systemic nature of cystic fibrosis. Since the disease affects mucus production throughout the body, the same abnormal mucus causes lung infections and pancreatic problems later in life. The thick mucus in the lungs leads to breathing difficulties, while in the pancreas it causes digestive enzyme blockages, leading to malabsorption and nutritional deficiencies. In clinical practice, when a newborn shows signs of Meconium ileus, doctors often start with imaging tests like X-rays to confirm the diagnosis. Treatment usually begins with enemas to soften and remove the blockage. If the obstruction is severe or complicated, surgery might be necessary to clear or bypass the affected part of the intestine. Recognizing Meconium ileus early is crucial because it allows for prompt treatment of cystic fibrosis, which can significantly improve long-term health outcomes. In summary, Meconium ileus is a direct result of the thick, sticky mucus caused by cystic fibrosis. It is often the first clue that a baby has CF and highlights how the disease affects multiple systems in the body. This early intestinal obstruction links directly to the broader symptoms seen in cystic fibrosis, including lung and pancreatic issues, emphasizing the importance of early diagnosis and comprehensive care. Always consult healthcare professionals for personalized advice and treatment options.